Hello everyone, myself Fathima Yenapoya, Assistant Professor cum Medical Laboratory Technologist, Unit of Medical Laboratory Technology, Yenepoya School of Allied Health Sciences. I am going to talk about the topic blood collection techniques. At the end of the session, students should be able to describe the properties of blood and explain various methods of blood collection and list out the complications during blood collection. First, we'll move on to an introduction about blood components. Blood is a red color fluid connective tissue with pH 7.35 to 7.45. Specific gravity varies. At 4 degrees Celsius it is 1.065 to 1.0590, and at 37 degrees Celsius, that is normal temperature, 1.0537 to 1.0475, and usually normal it's 5 to 6 liters of volume. Then it's composed of 55% of plasma and 45% of formed elements. We'll move on to that now, how the whole composition is divided into that plasma and formed elements. So whole blood is divided into 55% plasma, 45% of formed elements. Then again plasma is divided into amino acid, nitrogenous waste, nutrients, electrolytes, proteins and gases. Protein is again divided into albumins, fibrinogens and globulins. Then formed elements that are divided into leukocytes, platelets, erythrocytes, and leukocytes again divided into granulocytes and agranulocytes. Granulocytes are neutrophils, eosinophils and basophils, and agranulocytes are lymphocytes and monocytes. Lymphocytes are small and large, both are there. Then we'll move on to the collection of blood. So blood for all the tests is either collected in a vacuum tube or with syringes. So if you are collecting in a vacuum tubes, we have to choose appropriate vacuum tube with proper ratio of anticoagulant for each specific testers. So we'll move on to the vacutainers and uses. For each and various testers, there is a different type of vacutainers used. So red color vacutainers, that is plain one, there will be no anticoagulant in it. It's usually used for serological examination in biochemistry. Then sodium fluoride, it is used for glucose estimation, that is fasting blood sugar, postprandial blood sugar. Then next one, EDTA tube, that is lavender or purple color. It is used for hematological examination like complete hemogram and ESR. Then 3.2% of sodium citrate, that is light blue color. It is used for coagulation studies, that is platelet, that is PT and APTT. Then next one is heparin, that is green color tube, that is bone marrow studies. Then citrate is used for blood culture, and EDTA is used for blood bank tests, that is blood typing, ABO, blood grouping, etc. So we'll move on to the order of draw of blood. We have to follow an order of draw for the collection of tubes. So first we have to do blood culture, then we have to take the citrate tubes, then serum tubes, that is the plain tube, then heparin tube, EDTA tubes and fluoride tubes. Why? Because we are following the order of draw is that there is a chance of contamination, cross contamination from the tubes. So we have to follow this order while collecting the blood. Then methods of blood collections. Venous blood is collected, venipuncture. So usually we are collected from antecubital vein either by a disposable syringe or vacuum tubes. So these are the veins: cephalic vein, accessory cephalic vein, basilic vein and medium cubital vein. So first we have to clean the skin of the antecubital area of the arm with alcohol swab. We have to clean in a circular motion from center to the periphery. Why we are following this? Because we are pushing away the bacteria from the center to the outward, because we are going to collect it from that center area, and we have to apply the tourniquet 2 to 4 inches above the selected venous puncture site for not more than 1 minute, and we have to ask the patient to close the fist. The tourniquet provides a barrier against venous blood flow and makes the vein prominent. This is the blood collection kit with vacutainers, various vacutainers, then needle, syringes, then all the tubes, discarding tube, etc. So we'll move on to blood collection by syringe method. First we have to insert the needle of the syringe into the vein. Before that we have to clean the area. Then appearance of blood in the hub of the needle confirms that the needle is in the vein. Then ask the patient to open the fist as blood enters into the syringe and release the tourniquet after collection. When the required amount of blood is collected in the syringe, withdraw the syringe with a needle from the vein. Place the spirit swab at the skin puncture site, applied mild pressure. Then discharge the blood from the syringe into appropriate vials, which tests we are doing. Then next one, blood collection by vacuum tubes. The proper vacuum tube is selected and placed in the reusable plastic holder. A disposable needle is attached by screwing the threaded needle hub to the holder. The vacuum tube is then inserted to the holder until the top of its stopper is level with the marked guideline, which causes the tube to recede. Then patient's arm is placed slightly in a vertical position, and we have to note that for vacuum tubes, venipuncture should not be performed in a horizontal plane because it may result in backflow of the blood. Then needle is inserted into the vein similar to the syringe technique, and the base of the collection tube is pushed forward, breaking the vacuum seal. Then time is allowed for the vacuum tube to fill. Then ask the patient to open the fist, release the tourniquet and withdraw the needle along with the vacuum tubes. This is the procedure. First which I have already mentioned. Here also we have to disinfect the area with 70% alcohol swab and in a circular motion, means from center to the periphery. And after collecting, we have to discard the needle in the sharps container, and after collecting the tube we have to just make it upward and downward. We have to mix the sample like this, then label the tube for transport. Next one is capillary blood collection method. So capillary blood is collected either from fingertip, heel or earlobes. So fingertip usually we used to collect from the ring finger, then heel prick and earlobe collection. These are the equipments which is used for capillary blood collection: gloves, gauze sponges, then sharp containers to discard the needle, then the requisition form, alcohol wipes, lancet, then microtainer collection tubes and capillary tubes. So first we will move to blood collection by finger prick method. So first we have to clean the palm or except of the tip of the ring finger with alcohol swab and allow it to dry. So we have to use a sterile disposable lancet or needle. Then we have to prick on the lateral side of the tip of the finger so that blood starts flowing. We have to wipe the first 2 drops, then free flowing blood is collected. This is the finger prick method procedure. First we have to assemble all the equipments and supplies, then perform hand hygiene, put on well-fitting gloves, then wipe the fingertip with alcohol pad, then stick side of the finger with lancet, then wipe away the first 2 drops of it with alcohol pad, then collect the blood in the capillary straw until filled end to end. Then position the tube vertically, gentle tap the bottom of the tube, then remove the capillary straw together with its colored sleeve, then flick the tube vigorously for 20 seconds, then place sample tubes and freeze box for the transportation of the tubes to the lab. Then next one is blood collection by heel prick method. This method is usually employed for collecting blood from infants. Gently warm the heel by gentle rubbing, then clean the lateral or medial accept of the plantar surface of the heel using an alcohol swab, then prick by using a sterile disposable needle or lancet. Then next one, blood collection by arterial blood. Arterial blood is usually required for blood gas analysis. It is collected from the femoral artery. First feel the pulsation of the femoral artery below the inguinal ligament. Then we have to clean the area and collect blood with a disposable needle and syringe. These are the arteries: common femoral artery, deep femoral artery, brachial, radial and ulnar arteries. Then the most important part, the labeling of collection tubes. Immediately after collection, the specimen should be labeled properly. We have to provide the information should be in that labeling tubes are patient's full name, their age, sex and unique identification number or the hospital number which is provided for them, and date and time of the blood collection. So, precautions should be followed. Blood is never collected from an intravenous line or from the arm being used for intravenous line, and tourniquet should not be too tight and should not be applied for more than 2 minutes. Puncture site should be allowed to dry completely after cleaning the alcohol. Tourniquet should be released before removing the needle from the vein. All blood samples are considered as infectious and proper precautions should be observed while collecting the blood. And the complications of this blood collection is ecchymosis and hematoma at the site of puncture. Ecchymosis is also called as bruises. There will be the pooling of blood under the skin and the color change red to purple or black and blue color on the skin site will be there. And syncope or fainting is one of the frequent complications usually seen. Then failure to get blood because the needle might not have entered the vessel, and in obese individuals it's often difficult to locate the vein, so we should be very careful while locating the vein and collecting tube from obese individuals. And hemolysis of blood sample due to the narrow bore of needle is also a complication, so preferred bore size should be 22 to 25 gauges. I am keeping one video in this. I will be keeping the link of it under the description of this venipuncture using vacuum tubes. So summary, laboratory diagnosis of an infectious disease begins with the collection of clinical specimens. It will be not only blood, other clinical specimens are there. Then blood can be withdrawn from veins, arteries or capillaries. Then blood can be collected using either by a syringe or needle or a vacuum tubes. Blood is never collected from an intravenous line or from the arm being used for intravenous line. And tourniquet should not be too tight and should not be applied for more than 2 minutes and should be removed from the vein before removing the needle. And syncope or fainting is one of the frequent complication, and ecchymosis and hematoma at the site of puncture. And these are the references. Thank you.